I'm Lilah Morris-Wiseman. I'm the Chief of Endocrine Surgery in the Division of Surgical Oncology. I specialize in surgical treatment of endocrine diseases, including the thyroid, parathyroid, adrenal glands, and hereditary diseases involving the endocrine organs. I chose to pursue endocrine surgery because, to me, it involves the best of both worlds in terms of the medicine side of figuring out complex diseases that often are not understood by people who don't see them regularly. And then also the surgical side, which involves technical expertise, but also has a potential to cure patients of a lot of symptoms and diseases that are not well understood. My philosophy of patient care involves shared decision-making. So I want to work with a patient to provide them with best available evidence for what options there are for their treatment. But I really want to work with the patient individually to understand what their preferences are for care, which may be very different from my preferences, and to see how we can provide care that is within the context of their lives and their desires. My research interests involve optimizing the care for patients with endocrine surgical diseases, making sure we're providing the correct care, the most minimally invasive surgery when possible. And then I also have a special research interest in patients with hereditary endocrine diseases, making sure that patients are getting genetic testing when required, and that we are screening and following patients, not just to treat disease, but also prevent it whenever possible. I think as someone who lives myself with a chronic disease, I have a ability to relate to patients. I understand what it is to be going to frequent doctor's appointments and also be striving to keep healthy. And I feel like this gives me a lot of perspective on treating patients.